Family and Marital Counseling. Unit 5. Continuing theories in the psychology of family relationships, including social learning theory, communication theory, symbolic interaction theory, and communication theory. Virginia Satir is considered a pioneer of this theory in family counseling, emphasizing the importance of family bonding in a model she called joint family counseling. This theory highlights, first and foremost, communication and communication skills to help family members become more aware. Therefore, proponents of this approach believe that the core strategy for understanding how family members interact is through analyzing the communication process among them. This is done by analyzing the communication process among family members, and the family counselor focuses on how family members send and receive messages through the communication methods within the family system itself. Miro and Kautman argue that Satir's approach aims to rebuild negative family communication styles, characterized by blaming criticism. Satir encourages reducing hidden messages. She taught families about communication impact. The steps are a game for couples. Sit back to back and talk, then look into each other's eyes without touching or speaking. She encourages families to reduce hidden messages, believing if connection exists, there is eye contact. How does communication happen? To learn communication, Satir taught families a series of interactions about the impact of communication when there is no eye contact, touch, or harmony in speech. These steps come in the form of a game for couples. Have two people sit back to back and ask them to talk. Ask them to look into each other's eyes without touching or speaking. Each person should gaze at the other without touching or speaking. These steps come in the form of a game, which is as follows. This game is specifically for couples. First, have two people sit back to back and ask them to talk. Second, ask them to look into each other's eyes without touching or speaking. Third, each person should gaze at the other without touching or speaking. Fourth, ask them to touch each other without talking or to see each other. Third, each person gazes at the other without touching or speaking. Fourth, I ask them to touch each other without speaking or to see one another. Fifth, they stare at each other without touching. Sixth, finally, they touch, stare, talk to and discuss each other. In the final stage, the couple finds it hard to communicate with others, realizing the value of good communication for self-esteem and transforming the family from closed to open. Satir sees an open system as key to an effective family, while a closed one is rigid and inflexible. Train families to build positive emotional experiences, encourage fluency, creativity, and openness while taking risks. Focus on managing personal emotions. Emphasize listening, strengthening connections, clarity, and objective discussions. Freeing family members from the past and improving relationships fosters positive interactions and a healthy environment. Train the family to build positive emotional experiences. Encourage fluency, creativity, and openness while taking risks. Satir focuses on managing personal emotions. She emphasizes listening, strengthening connections, expressing clarity, and discussing differences objectively. Freeing family members from the past improves relationships, forming a family with positive interactions and a healthy environment. Her treatment approach includes building trust, developing awareness, generating new understanding, sharing this understanding with each family member, and using new behaviors. Expressing clarity and discussing differences. Sixth, freeing family members from the past contributes to positive interactions. Satir's treatment includes, first, building trust. Second, developing awareness. Third, generating new understanding. Fourth, sharing this understanding. Fifth, using new behaviors outside therapy. Through these changes, families feel less tension, more value, and increased self-esteem. Communication, reducing pain. Satir believes that complaints and pains within families are symptoms of dysfunction, and her treatment approach includes the following stages and steps. First, establishing and building trust. Second, developing awareness through experience. Third, creating and generating new understanding. Fourth, trying out and sharing this new understanding with each family member. Fifth, using new behaviors by the family outside of therapy. Through the family's movement within this circle of changes, they will feel less tension and more value, thus increasing self-esteem, communication, and care while reducing pain. By moving within this circle of changes, the family will experience less tension and more valued, and harmony, leading to an increase in overall self-esteem, communication, and understanding, and care, while pain decreases. The steps of family therapy according to Satir are: first, establishing and building trust; second, developing awareness through experience; third, creating and generating new understanding; fourth, trying out and sharing this new understanding with each family member; fifth, using new behaviors by the family outside of therapy